In the rural and remote areas where the lifestyle is a lot harsh, people still have problems with communicable disease. There is an increasing number of TB in the country, although partners are working very hard to reduce tuberculosis, but still we have very remote areas with high numbers of TB patients who do not have access.
The TB project covers free health services for TB patients in 5 different regions of the 6 regions in Somaliland. This includes having 5 different centers, which are located in Elgal, Lafta Farawane, Turuqsi, Woodwood, and Gudnabias. These centers include and are equipped with 7 qualified staff, which are a doctor, qualified and auxiliary nurses, and lab technicians. These qualified staffs help in giving the successful delivery of free health services for these patients. We started off back in August of 2016 with the needs assessment, where World Vision, SHiFAT, and the Ministry of Health's National TB Program went on a trip to these local communities in the 5 different regions. In September 2016, we started the construction phase of all 5 TB centers, and they were all completed within a month. We completed a needs assessment in the 5 different regions, where we went out and talked to the local community about TB awareness and the plans that SHiFAT and World Vision had for the TB centers. In 2 of the villages, there are already established mother and child health facilities, which will be integrated with the TB centers. While on one of our trips at one of the regions, there was already an outreach team from Aragaba TB hospital who had found positive cases. SHiFAT's qualified staff has taken over these TB patients and are currently doing treatment with them.
So we heard of Tropodoc through a volunteer from the UK, Mohammed Yusuf. We were aware that Tropodoc is an NGO that's run by 2 very dedicated doctor and midwife. We invited them to Somaliland. They have never been to Somaliland before. They have never heard of Somaliland or Somalia before. So they arrived, we welcomed them. They came along with some junior doctors who were volunteers, led by Dr. Adam from Doctors for All, who are based in the UK.
I originally came up with an idea with Mohammed to bring the sort of health care teams that various other countries in 2nd and 3rd world countries often receive. For example, like Bolivia, to Somaliland. So I met with Dr. Allen during my elective in my 4th year during medical school, and I thought, he's really open to the idea of actually traveling to healthcare, to communities where there is a healthcare need. So the idea was brought up and discussed, and we talked to Musa in SHiFAT, and it happened.
And we set out a plan for them in terms of where they would do the interventions. We targeted communities that were very remote and hard to reach. So we were able to execute that project, working in partnership with the Ministry of Health, working in partnership with the local community, and moving from one village to another village, doing some assessments, doing some clinical work, minor surgeries. So it was a very productive initiative. It's an initiative that we'd like to work with Tropodoc again and other NGOs who would like to deliver healthcare services to people who normally wouldn't get health services.
I can't think of the name of any village which stands out in particular. There are many villages with difficult healthcare situations, and this was made more difficult by them being nomadic, by them being cash poor. Many villages had money in livestock, but that doesn't give you immediate cash should you want cash to take your child to hospital or to transport to hospital or to get to the place of specialty, which would be Hargeisa. If mobile healthcare wasn't to continue, I could see a spiralling, diminishing medical service for the rural people. With mobile medical service, there'll be a struggle, but because of the nomadic nature of, they tell me, 70% of this country's people. But mobile is where you can catch disease early and get people appropriate treatment before they turn into
Our future plans for the TB project include on focusing on capacity building, where WHO will be providing training for 35 qualified staff. We also plan on going out and doing community awareness and outreach with Somaliland's national TB program. We also plan on providing essential and free health service delivery for these TB patients.